What can parents do if their child's carer is no longer able to look after their child?
Well, with reduced carers available, we're going to sort of need to look at the child's needs, and you'll have to think about when's the busiest part of your day, whether their needs are more in the daytime or the night time, and perhaps have a discussion about your care provider so that they can help you through and prioritise the tasks that need to happen. We accept that you might get some temporary carers who might not have all the skills you need, so they might be able to look after a tracheostomy but might not be trained on the ventilator, so you're just going to need to utilise the skills of any carer that is available to help you. You also might want to look at whether there's other family members that could help you, and if you have other family members that could step in, then our nursing teams will be able to provide some support. So perhaps contact your children's long-term ventilation service and see if we can provide some essential training for family members to help you through this time. For some families, we are accepting that when there isn't if there isn't carers available, then it is appropriate for your child to be in the same room as you with alarms on their ventilator and a saturation monitor on them overnight to try and keep them safe, and that you may need to contact your team to help you make sure that those alarms are all set up and working appropriately to allow you to safely look after your child overnight without you becoming completely exhausted by staying up the whole time. Don't change the settings yourself. We'll help you with that if you contact us.
Okay, and if parents have taken over providing that level of care and they themselves become ill with the virus, what are the options then?
So get in touch with us and let us know. Some of the hospices are still running and may be able to take over if there's no other people that can step into the breach to look after your child. But let us know, and we're trying to make sure that the most at-risk children are given a backup and an extra bit of help if they need to.
Where can parents reach out to if their equipment is broken or not working and they don't want to risk coming to the hospital?
So please follow your home ventilation care plan or care plan that you already have and follow that advice. If you're in any doubt, then do get in contact with your respiratory team.
So how do families get their consumables?
So first of all, it's a really good idea to keep a log of your consumables so you know what needs replenishing and when. Give your community team plenty of notice for reordering as you normally would. Liaise with your community team to discuss your needs in case your family requires a period of isolation. We would advise you not to stockpile consumables, please. If your child is on oxygen, your oxygen supplier will replenish the oxygen as it is needed and not leave you with any extra cylinders. So please make sure you give your oxygen supplier plenty of time to replace them.
And if parents have children that are ventilated via non-invasive face masks, what are they to do about the cleaning of those if they can't get hold of Milton solution?
Yeah, so some centres advise washing with warm soapy water. Other centres advise using Milton to sterilise depending on the child's need. We would advise at this time to wash all your circuits with warm soapy water, allow them to dry completely before putting everything together. Make sure you have enough of those consumables, and to do that weekly, make sure you've got clean hands before you change anything over.
If you are a carer looking after a child who is showing symptoms of COVID-19, what should you do?
If your child has symptoms of COVID-19, in the first instance, we will advise that you follow your escalation plan and contact your medical team. As regards with the carer, we would advise they contact their employer with regards to the correct and the most appropriate personal protection equipment to allow them to continue to come to your house and look after your child.